Hi guys, in this video we're going to look at the plantaris tendon and we're going to look at how that in itself can cause you pain and how it can sometimes contribute to Achilles tendinopathy. So if you have Achilles tendinopathy that just doesn't want to react to treatment, this video may give you a few ideas as well. So what we're going to look at is what the plantaris muscle is, where the tendon runs, how it can cause pain, and especially how it can kind of contribute to Achilles pain. And then we're going to look at the treatment options and why the traditional rehab that's sometimes being prescribed doesn't work when you've got plantaris pain, and also how you can adapt it, and different things with regards to running and cycling and why that can cause pain. We'll also look at injections that may be useful, and lastly at surgery. Brilliant. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. Okay, so what's the plantaris muscle and where does the tendon run? The plantaris is a tiny little muscle behind your knee, and it starts from the outside, kind of the lateral portion of the knee. So if I can stand up and just show that on myself as well. So if we look at the knee, it's kind of in this area that you'll find the muscle belly. But then the tendon crosses over the calf and comes down the medial side of the Achilles tendon, like you can see in this picture. So because it runs from the outside of the leg to the inner portion of the leg and eventually attaches to the medial part of the heel bone, any movement that causes pronation of the foot or the lower leg to turn in will increase the strain on that. And that's something to keep in mind for later. So as it comes round and the tendon comes down, it's interesting because it can actually attach in several different places depending on your specific tendon. Actually 9 different attachments has been identified in the research. So it can either come into the Achilles tendon, attach right into that at different levels, or it can just run really close to the Achilles tendon and attach straight into the heel bone. Also, the research has shown that the plantaris tendon can vary a lot in thickness. So anything from 2 millimeters to 6 millimeters, but there has been cases reported during surgery where actually the tendon has been nearly 10 millimeters. Did I just say centimeters or millimeters previously? 2 millimeters to 6 millimeters, not centimeters, but it can be a little bit thicker as well. So it's a very thin tendon. And also this is something to keep in mind later on when we look at treatments that can be useful. What else is important about? Oh yeah, not everybody has a plantaris muscle or tendon, and they're not quite sure why this is. We're thinking that maybe this is one of those muscles that we needed initially when we were walking around on all fours, because to be honest, apes also have them. But then as we evolved to walk on 2 legs, they've become less important. So now some people don't even have them anymore. With regards to function, again, we're not entirely sure why we have these muscles and these tendons. They can help point your foot down, so they're a weak plantar flexion, so they help the calf muscles, the gastroc and the soleus, in pointing the foot down or lifting you up on your toes when you're doing heel raises. But they're not very strong and they contribute a tiny bit of force to that. Also, they can help to bend your knee, to flex your knee. But again, it's quite a low level of force that they can contribute to that. However, researchers have found that they have lots and lots of muscle spindles inside them. And a muscle spindle is a specific little receptor that tells your brain, it helps for proprioception or position sense. So essentially, it tells your brain about where your leg or your knee or that area is in space and time as you're moving about. So it can tell it about force, position, depth, things like that. So they're thinking that maybe the main reason we've got that muscle is to help your brain better understand how to control your lower leg and your knee itself as well. So we're not quite sure about the function there. Now, let me just see what I'm leaving out with regards to that. That's it. Okay, so how can the plantaris tendon cause pain? There are 3 different ways in which it can cause pain and what we've seen through research, what they find when they go in there. Now, the first of all, the plantaris tendon itself can develop a tendonitis or tendinopathy in isolation. So it's just the plantaris tendon affected, not the Achilles tendon. Then we can see instances where the Achilles tendon is affected, but it's right in a place where the plantaris tendon seems to be compressing around it, because you've got to remember that plantaris tendon crosses the calf and comes down on the inside of the tendon. So in certain circumstances, the plantaris tendon can compress against the Achilles tendon, and they think that that can then irritate the Achilles tendon and cause a tendinopathy there. But then thirdly, you can also get it that you have both plantaris tendinopathy or tendonitis plus Achilles tendinopathy or tendonitis, so the two together. So there may be three things at work here, and in all honesty, that's what we find most often in human bodies, because we are all so different that there's never quite just one cause for something. There's always several factors to consider, and that's why it's useful to work with a clinician who can help you kind of untie this and figure out what's the best for you. Now, it's important to understand that as I talk through this, it may sound that a lot of your pain and stuff that you have in your Achilles has to be from plantaris, but a lot of these symptoms can overlap, and it's only a very small portion of people with pain in the Achilles area that will also have plantaris issues. Now, traditionally, we've known for a few years that plantaris tendon can compress and irritate that medial mid portion of the Achilles tendon, but recently, research has also shown that maybe it's involved in some insertional tendinopathies that don't want to resolve, especially if you have pain on the inner part of the insertion of the Achilles tendon. There's a study from Alfredson et al. That came out in 2020 or 2021, I forget now, that showed that. Okay, so if we think of the three different ways that plantaris can cause issues, two motions at the ankle joint specifically is quite important when we think of the cause of plantaris compressing against the Achilles tendon and causing trouble there. And that is when your foot pronates excessively, so turns in. Because the tendon crosses over the calf, if your foot turns in, it's going to pull that tight and can compress it further against the Achilles tendon. Second is, if your foot moves into dorsiflexion, excessively, especially into dorsiflexion, that tendon again is going to compress more, and that can cause more pain and more injury there. So those are the two movements to keep in mind when you think of your rehab as well, and how to offload the tendon to allow it to recover. Good. So, yes, the other important thing to remember is that, yes, we've seen that the Achilles tendon and the plantaris can be affected in the same area, but all of this research can't show us that, yes, it's definitely the plantaris tendon pushing in that area causing the tendinopathy. It can just show us that both of them are there. So we can think about why the reasons may be, but there's not clear evidence indicating that yet. Good. So if we think about plantaris pain with running, so what things in running can specifically cause your plantaris tendon to flare up, then it's the foremost reason would be increasing your volume of running or your running intensity too quickly. And the plain reason why that can cause plantaris issues is that it's a too sudden load increase, so the plantaris tendon can't have enough time to adapt to the new training loads, especially if you're somebody who pronates a bit more, because it will take more load then, and then it becomes injured. And this is the reason for most tendon injuries anywhere in the body, is if the load increases too quickly. Now, secondly, anything that causes excessive pronation while you run can also load that tendon more and cause injury. So we're thinking about things like if you've got really flexible running shoes that causes your foot to pronate really quickly when you step, or really hard running shoes can sometimes do the same thing. If you do a lot of uphill running, because that will increase the dorsiflexion angle in the foot, or if you just have a biomechanical issue around the ankle that makes it pronate more easily. Sometimes, like with myself, I've got really lax ligaments, so my foot just needs that a little bit of extra support, otherwise it overpronates excessively. But then also weakness around the hips can cause extra pronation while you run. So those are all things that can contribute to plantaris pain and injury while running. Now, how about plantaris pain while cycling? So it's not that common to get plantaris tendon issues from cycling. But if your plantaris tendon is already painful, then cycling can irritate because that position on the pedal takes the foot into more pronation, dorsiflexion, and that then compresses the tendon more often, and will stretch it to an extent. So if your plantaris tendon is already painful, then cycling may actually irritate it further. And that's quite a lot, or quite similar to insertional Achilles tendinopathy, where cycling can often irritate that as well because of that compression element. So that's again something to keep in mind if you're wondering, why is my Achilles or my pain in the mid portion area hurting more from cycling because I'm not even running. So then we get to the bit of how do you actually distinguish between Achilles pain and plantaris pain, because I can tell you that the pain is usually, it feels more like it's part of the Achilles. It's not really easy to say, oh, that's definitely plantaris pain. So there's a few things that can make us suspect that. The first thing is, remember, your plantaris tendon runs medial or on the inner side of the Achilles tendon. So your pain from plantaris tendinopathy will always be on the inner part of the tendon. It will never be on the outside. So when we think of Achilles tendinopathy, mid-portion Achilles tendinopathy specifically, it can be right in the center of the tendon, it can be on the outside of the Achilles tendon, or it can be more on the inner side of the tendon. Now, if it's plantaris that's involved as well, it will only be on the inner side of the tendon. But just the fact that you've got pain in this area doesn't mean it is plantaris. It can just be a pure Achilles without any plantaris issue. Then also, the pain for mid-portion Achilles tendinopathy is usually within the first 6 centimeters of the Achilles tendon. Now, typically for plantaris tendon, it will be a bit higher than that. But again, it can vary between people. Then, mid-portion Achilles tendinopathy often doesn't mind if you take it into a stretch position and you do your heel raises over the side of a step. So it often improves quite quickly when you start doing that. Whereas if the plantaris is involved and you do your typical eccentric drops over the side of a step, it will often flare that pain up. So if that happens and you thought you had a mid-portion Achilles tendinopathy, then it's likely that you actually have a plantaris issue as well, and dropping into that position compresses it and strains it further, and therefore it's hurting. So that's important because we've got to keep that in mind when we think about what rehab exercises to do. What else gives you an idea? Okay, so you can see how none of those things are definitive for plantaris tendinopathy or tendonitis, because all of them can be present in regular Achilles tendinopathy as well. So the best way, or the only way to definitively know if it is plantaris, is through scans. Now, ultrasound scan can pick it up, MRI scan can pick it up, but both of them can also miss it depending on which part of the tendon is affected. Now, there's a new type of ultrasound scan that's come out, but not all scanners can do it yet, where they actually can give you a 3D image of the structure of the collagen in your tendon. And with those scans, it's easy to actually pick up which part of the tendon is properly affected. So those scans are more useful these days. However, do not worry about having a scan and really pinpointing which part of the tendon is the issue. Because if you're seeing a skilled physiotherapist, they shouldn't worry too much about what's going on in your scan, except if it shows a tear, then it's going to guide treatment. They should be going on how your symptoms are reacting just day to day, plus to the exercises they've given you. Because if you see an uptick in symptoms, the exercise has to be adapted that the pain comes down. If it's tolerated, then we've got to see if we can increase the load over time to get you stronger. So you don't need scans to decide that. You've got to go on symptoms of the patient. And that's why it's also important as a patient to feed back to your physio and tell them if your exercises are not working as expected, if your pain is suddenly worse. Because as you can see with the diagnosis, it's not easy to get a clear diagnosis, and sometimes it's a little bit of trial and error. But if you feed back to your physio quickly, they can adapt your program for you, and then it can all fall into place. Okay, so if we think of what treatments are useful for plantaris tendinopathy or tendonitis, then the first thing, and it should always be the starting point for any tendon rehab, is load management. Now with load management, we mean that you've got to reduce the load that goes through that tendon so that it can have time to recover. So yes, that may mean that you reduce your running volumes. You may have to, if it's quite flared up, you may have to switch running out for sports that doesn't irritate it, like swimming or things like that for a while. Sometimes it's just about adapting where you run. Like for instance, with the Plantaris, running up a hill will be more aggravating because you get more dorsiflexion. Also, running on really soft surfaces, to be honest, that also irritates the Achilles tendon, will irritate it because you're going to get more dorsiflexion, but also a lot more pronation in there. So choosing flatter ground that's a little bit harder and doesn't force your foot into so much pronation may be all you have to do to take the strain off it. But other strategies that can help is if you wear orthotics, that kind of reduces the amount of pronation you do, because that can take the strain off the Plantaris tendon. If you're not sure if you need orthotics, then using tape to just limit the kind of stabilize the foot that it can't turn in so much could be a good experiment to just temporarily take the pronation out of the action there. What else? Running shoes can make a big difference. So if we think of really flexible shoes versus more supportive shoes, so just getting some of those shoes that doesn't quite, or that don't allow you to collapse in so much, that may be already a good thing to change in your gear. So there are plenty of ways to offload it. Now, also remember, it's not necessary to offload it more than what you need to. So you don't need to completely rest. If you work with somebody who can help you identify what things are really aggravating, what things you can continue with, then you may be able to maintain your fitness to quite a good degree while you recover. Okay, then next thing to want to reduce to offload it is if you want to temporarily limit dorsiflexion as well. So okay, there's actually a little bit of a contradiction here, because sometimes if your ankle is really stiff and doesn't allow enough dorsiflexion when you move, that can force you to pronate more and actually cause overload. But now that the tendon is painful, if you're going to try and do dorsiflexion stretches to improve that, you're actually just going to irritate the tendon further, because when you go into that stretch position, like the typical runner's stretch, one leg behind the other, you're going to stretch the painful tissue, and that will flare it up. So if you want to increase or improve your ankle range of movement, leave it for later when you're recovered a bit more. For now, if you think of strategies to just take the strain off and reduce that dorsiflexion range in the ankle, if you put a heel lift in your shoe, so just like with insertional Achilles tendinopathy, just lifting the heel up a bit can make a difference. Or sometimes just avoid walking around the house without shoes on. Just wear your trainers that has a heel on them. That may be enough. Definitely avoid calf or Achilles stretches. So that typical runner's stretch where you have one foot in front of the other and you lean forwards to stretch your calf, leave it out until your tendon is totally recovered. Also, not dropping your heels over the side of a step, because again, that's going to cause more compression between the Plantaris tendon and the Achilles tendon, and that will likely also increase your pain. What else? Okay, those are the main things for dorsiflexion. Then, if we think of the second thing with regards to rehab, is obviously strength training, because any tendon that was injured needs to be strengthened up to be able to cope with your sport again. Now, there are three components when we think of strength training for the Plantaris tendon and to support that. The first is the obvious one that will strengthen the tendon itself, and those are the heel raises, where you go up and down on your toes. And especially if your Achilles tendon is also involved, that it's not just a pure Plantaris tendon, then you want to be doing those heel raises because you've got to address the Achilles tendinopathy as well. But if we think of the fact that we don't want to cause the compression between those tendons, you want to do those heel raises only to floor level. So do not do them over the side of a step initially until your tendon has fully recovered. So typically we'll start patients off doing them to floor level, even with shoes with a bit of a heel raise in them. And as the tendon settles and as it starts to build some strength, we start getting them into a new, more neutral position, taking the heel lift out, And then eventually, once you've built a good level of strength and the tendon is properly settled, then you can move over the side of a step and allow a bit of a drop there. Because you want to be able to do that again, because you want to be running up hills. So you have to work towards that. But sometimes it can take 3 to 4 months before you can start working to over the side of a step. So you have to remember that rehab for tendons takes several months, not a few weeks. And that's just because the collagen in the tendon takes a long period of time to react to the exercises. Then the second type of strength training you want to be doing is if we think of the factors that may have contributed to this. So if you have weak glutes, so glute max, glute med, that can cause your leg to turn in more when you're running, and that can cause more pronation in your foot, which then puts more strain on your, I'm never going to remember this, Plantaris tendon. So glute strengthening exercise is an important component. And then thirdly, if your issue is around the ankle that makes you pronate more, say for instance, you've got weak arch muscles, or your tib post or tib ant isn't quite as strong as it should be, adding in some exercises to strengthen those may be helpful. I will add in there, if you have a really flexible foot where the ligaments aren't really controlling it, you will likely require external support as well, like an orthotic. But it's not true for everybody. It's just a subgroup of people. So it's useful to ask your physio or podiatrist about that. Okay. Now, what if you've done the perfect rehab and it's just not reacting? Then the first thing to try is injections. Now, there's not a lot of research with regards to how useful injections are, but what the experts in tendinopathy, and especially with regards to Plantaris tendon, is suggesting at the moment is to try high volume injections. Now, when they do a high volume injection, they inject a high volume of sterile fluid, and they usually try to separate the Plantaris tendon from the soft tissue around it, because sometimes when something's been irritated for a long time, it can form adhesions or attachments to other structures where it shouldn't be attached to. And if you can just loosen them off, that they move smoothly, it can reduce the pain. So that has been shown to be useful for some people, but there's not a lot of research yet to support it, and there's a lot of work to be done still to know whether it's really useful. But if your only other option is surgery, it's definitely something that I would try first. Okay, I don't know about research with regards to PRP injections or things like that at this point, specifically for the Plantaris tendon, but it's again something that I can see in the next few years will likely be researched. The Plantaris tendon has only recently been discovered to be an issue in Achilles pain. So there's not a lot of research done on it yet, but it doesn't mean that it won't be done in the future. The only thing that has been researched with regards to this is surgery. And it's usually because these patients with seen as Achilles pain has been referred to surgeons eventually because they've not reacted to the traditional heel raises over the side of a step, which we know now is probably the wrong thing to do. And they've just not gotten any better. So then they end up at the surgeon. And what the surgeons have done then is they were the first guys to open up to see, to clean the Achilles out. And then they go, oh, actually, it's the Plantaris tendon that may be an issue here. And surgery seems to have really good result, both in the short term and the long term with regards to pain and structure to the Achilles tendon. So let me explain what they do. There's two types of surgery they do. They either just scrape the tendons, that they kind of get rid of the adhesions and stuff, or more commonly these days, they'll do the scraping, but they'll also remove a large portion of the Plantaris tendon. Now, it always sounds a bit dodgy when people start removing tendons and stuff, but the Plantaris tendon is so small, and we're not really entirely sure that it really adds much to function, that these patients seem to do really well. They have good reductions in pain that last for longer than 12 months. Plus, if they look at the Achilles tendon structure again 6 months or so after the Plantaris tendon was removed, you can see that that tendon is actually, the Achilles tendon is recovering. So there is a place for surgery if your tendon is not recovering or your pain is not settling down. However, I will also caution that a lot of things that we don't understand, we may feel is insignificant and don't really play a big role in the body, and we just remove it. Until we do more research and then find out that actually it is quite important and we've caused other troubles through it. So I would always try rehab first before you jump for surgery. And then it's important to make sure that you're trying the right type of rehab. So if you feel you've tried rehab, but it involved heel raises over the side of a step that just made your pain worse, and your physio hasn't adapted that for you when you reported that back to them, or you've just been doing the same exercises. I often get people where they've been given heel raises to do with just their body weight, and it's never been changed for 3 months. Well, you're not going to get stronger if you just do the same thing the whole time. There has to be weights and stuff added to that over time to get you stronger. So make sure that your rehab was adequate before you go for surgery. Brilliant. Now, let me know if you've got any questions. And remember, if you need more help with your Achilles injuries, you're always welcome to consult one of us via video call. The link to the website is in the description of this video. Take care.